Now, before we dive into the session, what I always like to do is just give you an overview of what's coming in a nutshell. So then you can decide, is it actually worth me watching the full webinar? Because you know exactly what I'm going to cover. So we'll start with, firstly, what is an upper limb screening assessment? Like I said at the start, this is just the basic components that you need to be aware of and maybe screen and look at. It's not really a very thorough, detailed upper limb assessment that you may do like in a neuro caseload or something like that. So this is just a bit of a taster that could apply across any caseload where you come across a client who's got upper limb impairments. It's important for us to consider because hands and arm function is so important to everyday function. So if there is an impairment present, we want to be able to identify that and make sure that we're taking appropriate action for them to seek some assistance or for us to put in place some sort of therapy program to address the impairments. What we'll dive into then is the 10 components. To hopefully make it a little bit easier, I've given you 10 key areas that you need to look at, and it'll go through a bit of a journey from looking at function, look in terms of what things look like, what things feel like, and how the movement quality is. So the 10 components are firstly history. So you're listening to the client's story about their hand or arm function and their impairments. The function itself is where we get them to actually have a go at some sort of functional reach, grasp type movements in the context of a daily activity to see for ourselves grossly maybe what could be an impairment that we need to look deeper at. And if there's no issues presenting with their everyday function, then sometimes we don't actually need to continue with the rest of the really detailed screening assessment at all. Then we'll look at appearance. So looking at things like edema, skin integrity, how it's resting when you first go in terms of the resting position or any deformities. Then we've got passive range of motion where we're passively moving the joints through different range of motion to see if there's any pain, if there's any increased resistance or tone, which does lead to the next one, which is where we're looking specifically at tone. So is there any increased muscle tone or decreased muscle tone? Is there any spasticity present as well? Sensation is what they can actually feel. So it could be sensation to touch or temperature. Proprioception is linked to sensation. It's in terms of do they know where their joints are in space? Active range of motion, which is where we will get them to have a go at moving their different joints through the full range of motion to see how far they can actually move. And then strength is to check the power behind the movement. So what is their grip strength? Can they actually withstand any resistance if we're pushing against their elbow or their shoulder movements? And then finally, we have coordination and we look at how smooth and accurate are their actual movements. And again, sometimes that will overlap with when we're looking at active range of motion and function as well. Then I'll give you a quick fire case study where you'll be able to see all these elements in action in terms of what are some of the considerations we would do with a real life client. And for the documentation, I've just got an example already written up for you. I'm not going to go through it in a lot of detail, but in this case, this is one of those examples where a SOAP type format can actually work well because a lot of what we're doing is very biomechanical in nature. Now there'll be a wrap up with some extra homework tips and things that you can go and look at in your own time. So as always, lots to get through, so let's get started.